All right, good morning, everybody. Today we're going to briefly discuss three ransomware groups that are affecting healthcare organizations. If you've read my blog, we have picked three prominent ransomware campaigns and ransomware groups that are currently targeting hospitals and healthcare organizations. The first one is Zeppelin. It is believed to be operated by a Russian cybercrime group. The code that they use in Zeppelin is based off of a previous piece of ransomware called VegaLocker, and their campaign began in 2019. The second is Ryuk, or AKA Conti. This is believed to be executed by a Russian cybercrime group as well. However, its code is most likely based off of a previous piece of ransomware called Hermes, which has been attributed to North Korea. And the Ryuk campaign began in 2018. The third piece of ransomware is the Sodinokibi, or Sodin, or Revil, it's sometimes called. This is also believed to be operated by a Russian cybercrime group. And the operation closely resembles the Crab ransomware operation. And this began in 2019. One interesting thing about Sodin, or Sodinokibi, is that this is a true ransomware as a service campaign, and the creators or the operators of Crab, once they stood down and disassembled that operation, they actually picked up affiliate hackers and paid them anywhere between $10,000 and $50,000. And they're creating the malware, but the affiliate hackers are in a revenue sharing model. So they're the ones that are actually operating the ransomware. They get constant updates, but they share anywhere between 50 to 70% of the profits, whereas 30% of the profits actually go back to the Sodinokibi ransomware developers. So these three ransomware campaigns, they have very common tactics, techniques, and procedures. So from an installation perspective, usually it happens with a spam or phishing email that is sent to the organization. Now, one of the things that is also sent are things like privilege escalation tools, remote access tools, and some lateral movement tools that are commonly used. But I think one thing that should be of note here is that sometimes the ransomware operators are not the ones that are sending out the spam and phishing emails. One thing that we saw with Ryuk is that ransomware operators were actually buying Emotet and TrickBot infection. So there was a separate malware family that was installing banking Trojans throughout organizations, and that if the organization was significantly large enough, or it made it a good target from a ransomware perspective, these operators were actually purchasing the Emotet and TrickBot infections. So one of the other things that happens is hackers will find vulnerable remote services like RDP. And so if the service is open to compromise, if it's vulnerable to a known exploit, these individuals will go scan the internet looking for and exploiting vulnerable remote services. Also, if it's an authentication portal that doesn't prevent failed or multiple failed logons, these are just simply brute forced. And one of the things that we also see is that these individuals, once they compromise these remote systems, they will actually then try to sell them to ransomware operators. And this is an example. So we have a known threat actor out of Russia named M1X, and he is selling a RDP access to an administrator's PC for $1,000. And it is a hospital. It includes 20 terabytes of information. But you can see here that, once compromised, these individuals will put these things usually on the dark web or onto hacking forums and then sell them to potentially ransomware operators. So once the target is infected or the operators take over an infection, one of the things they usually do is they start turning off all of the logging, turning off all of the AV, and turning off all backup scripts. So PowerShell is typically used obviously on Windows. And then if the Windows system does have antivirus, there are several scripts that will either disable or completely remove the antivirus. And then also there are anti-backup scripts in order to make sure that Windows recovery services aren't working, as well as things like shadow copies of critical files to remove those as well. And then once on the system with no AV and no backup scripts and no logging, they will then start pushing in more lateral movement, privilege escalation tools, and exploit kits. So one of the common things that we see is things like PowerShell Empire, Cobalt Strike in terms of lateral movement tools, and Mimikatz, something just so simple that you can just dump passwords in clear text from the LSAS process within Windows. Now, once they've compromised the system and they've dumped username and passwords that are potentially utilized throughout the organization, they'll start targeting the domain controller if one exists. And when they target the domain controller, they'll utilize known exploit kits, or they'll just use the previously compromised credentials. We've seen both work. And an important note there is that if they cannot compromise the domain controller, they'll just laterally move from system to system looking for common username and passwords. Unfortunately, it's sometimes common in healthcare organizations to have a local administrator account that either has the same password or some sort of known password permutation. And then they'll just go throughout the environment mounting admin, $, IPC shares, and utilizing either CertUtil to download the tools and the ransomware itself, or just utilize the compromised system as the distribution point or domain controller as the distribution point, and then subsequently run the ransomware with something like PSExec. So once the device is infected, we're seeing these ransomware operators completely oversee the distribution and infection of the network. So they are making sure that the compromise is as large of a scale as it can be. And then once the ransomware is executed, it's going after critical documents and images like doc, docx, PDF, JPEGs. And this is also tailored to the organization. So when they're compromising systems, they're also looking for the common files that are utilized that have important information in them. And so once the entire network is infected, the operators either start mailing employees through email or launching a notification to infected systems, just notifying that the organization has been infected. And also an important note is that the payment amounts typically vary between the size and revenue of the organization. So these operators are truly looking at the target, not only from an infection perspective, but also from a business perspective to see what pricing typically works with an organization that size. Another note in here is that some of these organizations like Soden, they're starting to create their own blogs on the dark web. So on top of encrypting all of this information, they're also exfiltrating choice documents. And so what they'll do is they'll actually take these choice documents, and on top of the ransom, they will say, if you don't pay within a certain period of time, we are going to announce the breach publicly, and we are going to release sensitive unredacted documents. So it's further shaming an organization into paying the ransom as quickly as possible. And let me show you a Soden attack. This is a Soden attack that is on the dark web right now. And this is the website that the victims would then go to. You can see here that the current price that they're asking for is 25,000 United States dollars. They have until October the 12th to pay. And then if they don't pay, it is a $50,000 kind of starts over and starts increasing the price. And you can see that they're linking a Monero address versus a Bitcoin. So they're using cryptocurrencies that are less likely to be traced, or in some cases impossible to trace. Here you can see that they say that they will decrypt your files. They give you kind of instructions on both how to pay them and then, what the delivery mechanism looks like from a decryption perspective. They also give you a trial decryption just to prove that they have the keys in order to unlock or decrypt your files. So you can take, in this case, an image file, upload it here, and they will show you the decrypted image. So they also provide backend chat support. So you can chat with operators. Typically, these operators are paid for by the ransomware as a service organization. And they're just contractors that are in the backend helping with payment, and they're helping with the delivery of the decryptor tool. And here you can actually see that they're telling you who they are, but they're also down there in the guarantees, they're linking to articles that show that their decryption tool works better than other decryption tools like Ryuk. So this is kind of interesting, from a service perspective. They're trying to, show that they are reliable with their decryption, but also these are ransomware operators. These people are holding a company for ransom, and then in some cases, shaming the organization to pay by announcing a breach and then showing critical data. So how can Ordr help? So from a proactive perspective, we can obviously identify and patch vulnerable systems. So utilizing Windows remote management integrations, we can tell you which systems are vulnerable and need to be patched. Additionally, if systems are legacy systems and cannot be patched, we can use segmentation policies based off of historical communication behavior in order to isolate these systems so they're only communicating with devices that they need to communicate to and are not available throughout the network. And then also we can ensure that critical systems are regularly communicating with whatever backup services. Because at the end of the day, the solution for ransomware is having all of your files backed up and something that you can replicate quickly. From a reactive perspective, we can identify anomalous communications within the internal network, things like sequential scans, abnormal SMB, RDP, RPC communications to machines that have never kind of historically sent or received those types of communications. Utilizing our deep packet inspection and intrusion detection system, we can alert on common lateral movement exploits like Eternal Blue that targets SMB v1 on legacy unsupported Windows operating systems like Windows 7 and Windows XP that we find commonly in healthcare organizations. We can also alert on known C2 and payload server communications. So one of the things that we have in the product is we do have a list that's updated once an hour that goes through and gathers all of these C2 and payload servers. So if they are known to us and one of the machines reaches out to one of these servers, we will absolutely alert on it. And then track user creation and user log on and log off behavior through WinRM and Active Directory integrations. And this is important in lateral movement because we are seeing as part of the TTPs that users are being created both locally and within the domain controller themselves. And then ultimately, once this anomalous behavior is detected, you can of course turn the switch ports off or completely isolate the compromised systems into segregated VLANs or subnets. So the key takeaways here, the takeaway that I really want to push in this presentation is that these are not autonomous self-propagating malware events. This is not something where a user clicks on a phishing attack and then all of a sudden the company is completely infected with ransomware. These are hands-on compromises and sometimes with sophisticated actors. And so that is an important point because we are seeing not necessarily, obviously self-propagating pieces of malware, but we're seeing, something more akin to a penetration test or tools that are used by system administrators and hackers in order to compromise networks. And because there's operators behind these, the TTPs can change at any time. So the second that there is a 0-day exploit available, like there was last week with zero logon, these operators can take advantage of that immediately and pivot throughout the network or utilize it to compromise the network and install ransomware. So are there any questions about this presentation?
I do have a quick question for Jeff, and I think he basically just answered it. But we've been seeing these sort of malware attacks for really 4 or 5 years in healthcare, and the problem obviously hasn't gone away. If anything, you could say it's probably gotten worse. Do you attribute that because there are just so many active threats out there, and they just keep pivoting to the next sort of vulnerability and using that as their sort of entry into an organization? Or why hasn't the security community gotten a better handle on, I guess, ransomware?
Well, I mean, I think there's two questions there, right? Like, why has it been so prevalent? The answer is simply why is it so prevalent is the money, right? With just one of these, I believe Ryuk, it's been around since 2018. Some of the estimates are over $10 million in revenue from that piece of ransomware. And so from that second question in terms of why security teams haven't really gotten a handle of ransomware is I think we're thinking about ransomware wrong, right? It is so profitable that you have these kind of nice organizations, these organizations that are well organized, utilized in both breaking into systems, hacking systems, pivoting throughout the network, and then installing this stuff. This isn't Zlob or WannaCry or NotPetya. This is truly a hacking event. And obviously during the pandemic, we saw a ton of healthcare organizations having to start supporting a remote workforce. Unfortunately, we've just seen them put vulnerable systems out on the internet. And also because they're these threat actors are making real money off of this, they're utilizing zero-day exploits like that zero logon from last week. And it is very difficult for an organization that potentially has, let's say, hundreds of thousands of devices and hundreds of thousands of computers within their organization. It's hard to patch something within a day. But these operators are literally taking the proof of concept and utilizing it to infect networks with. So I think that why hasn't security organizations really gotten a handle on it? It's very different between an autonomous piece of ransomware or malware that is developed on an exploit that was 6 months ago, and they haven't patched their systems in 6 months. There's something to be said there in terms of lacking from a security perspective. But I fear that some of these organizations don't have a chance against an operator that is extremely motivated to get into their network, particularly if they have their hands on zero-day.
Thank you.
Hey Jeff, this is Steve. So if you had to pick maybe a top 3 things that our customers or other healthcare organizations could do to either stop or slow this down, do you have a list or that you have in your mind of maybe 1 or 2 or 3 things that they should be doing?
I would say first and foremost, anybody with experience with ransomware and ransomware compromise is that backups are absolutely critical. You need backups. You need backups that are both online and offline. So, online in the sense of it's immediately available, so you can start rebuilding systems, and then offline in the sense that the hackers can't get to them. Because one of the things that we've seen is that the true answer from a ransomware perspective is like, hey, I'm not going to pay it, and I'm just going to restore from backup from this the system files that I have, or the important documents that I have, and that the attackers will actually find them. So if there's shadow volume copies of important documents or system files, they'll go after those and remove those before installing the ransomware. They'll remove local backup services like system restore points. And then additionally, if there are network backup systems or NAS drives that are used for regular backup routines, those things are targeted almost immediately, because they're not going to get paid if the company can replicate the backups, and just the only thing that's lost is time. But yeah, they are targeting those online systems. And so I would say both online and offline backups, or backups that are not available immediately to network administrators and then subsequently these hackers, very important. I would say secondarily to that is to really look at the standard blocking and tackling from a security perspective. I think everybody's enamored with the latest thing, but at the end of the day, these compromises could have been mitigated or completely prevented with just regular patching. And regular patching on cadence, that also requires a accurate asset inventory in the sense that you can't patch a system that you don't know about. And we are seeing within healthcare particularly that the asset inventory systems are lacking. And even the most complex asset inventory systems, they might be accurate once a week when scans are run. So I would say that that's a value that Ordr can bring in is to be able to give organizations that real-time asset inventory so they can figure out if their patching system is lacking. But yeah, backup, asset inventory, and patching. Thank you for the questions, everybody. I really appreciate it. Thank you for joining. Bye.